So this is basically the EMIS web console that any a GP practice sees or receptionist see from their perspective, and this is where all the medical data and medications and all that referrals and everything is managed from a GP practice perspective. And what we've done is we've introduced a button in EMIS web itself, which is this patient access. It's called patient access signposting, but in the subsequent release that's going to come, it's called patient access connect. And we've added this button in a number of places across the EMIS web portal. So you can see in here in the appointments book section, but we've also added this button in the summary consultation as well. So if I look for my test user, you'll see that the button itself is appearing in the consultations. The reason we've added this button in these multiple different places is depending on the context of the practice or the clinician or the care navigator is having the conversation with the patient, they can then refer them into a different care pathway depending on their needs. An example of that, which will become apparent, is if you can imagine if you're in a practice and you want to refer the patient onto a smoking cessation service or some sort of social prescribing service because the patient wants to give up smoking, then you can refer that as part of the GP consultation. But for the purposes of demonstration that we're going to do today, we're going to talk about it from a GP CPCS perspective. And the most common use case we expect in this situation is a patient is contacting a GP practice to book an appointment in with a GP practice. And obviously at this point in time, whoever is the person who looks after the appointment book would want to have it in here so they can then refer the patient off into the pharmacy itself. In terms of the button itself, by default, this button is disabled. This code that I'm going to demonstrate actually resides in every single GP system right now, but we've only enabled it as per the rollout strategy. So when a GP practice is signed up for this service, we've then activated this button. So this is the button itself. And forgive me if I'm going really fast. And if you do have questions, somebody can drive that because I've done this so many times that it's kind of autopilot for me. So do stop me because if I go too fast as well. So what's happening at this moment in time is a new a widget or a component is being booted up on top of EMIS web itself. What was really, really critical for us as part of the system that we were deploying was not to have a separate interface where you have to remember a separate login, a separate authentication, have to double key data from your clinical system into this system to make sure that then the right data is then passed across into the pharmacy system. We wanted to make as much of this as possible automated, integrated, single sign-on experience with auditing control as well, which means that you can actually reduce the amount of work you need to do just by hopefully clicking a few buttons. You can then refer the patient on into a care pathway in relation to GP CPCS. So this is the interface that loads up. You can see in here some patient metadata that's come across. We'll come to that in a second. And you can also see the practitioner who's logged in and opened up this widget, which in this case is my test account for Dr. EMIS test. And what you have in here is then a bunch of services that have been enabled for that GP practice to refer the patient into some care pathway in their location. For the purposes of our demonstration, it is NHS minor ailments, which is the GP CPCS consultation service. What you have in here are 3 call to actions: a create referral, an assessment for referral, and a referral report. So we'll start with assessment for referral, and then we'll go from that point onwards. So what assessment for referral is a triage tool capability that the receptionist or the care navigator has to ask certain questions of the patient. So then when they they can refer the patient on with some security that they're being referred with some triage being done. The tool itself, the questions and the referral flow itself has actually been designed by Dr. Sarah Jarvis and her clinician experts. They've reviewed this from a clinician's perspective and signed it off, and they've used their expertise as clinicians to ensure that they can make sure the right referrals can be made. Within the tool itself, what you have is certain conditions, and based on the answers that you put based on those conditions, the patient may be referred off into a different care pathway rather than a GP CPCS referral. So I'll quickly demonstrate that. The first question, the solution itself from the NHS perspective was recommended to be only for 1 year and above. Hence, we have this question at the beginning. So if I said, yes, your query relate to a child under 1 year old, and I press yes, then you can see in here that there's a there's a instruction or a call to action to the receptionist or whoever's completing this form that says that this patient needs to be seen by the GP clinician today during the current surgery session. So they can stop whatever they were doing, book them in for an appointment slot, and then the patient can then be referred to that appointment. We do have, and one of the things we are exploring already is the ability for patients to self-triage themselves, which I think is the future. So part of that is, how do we get a patient to self-triage themselves as part of trying to book themselves in for a GP CPCS minor consultation. And as part of doing that flow, we can then give instructions to the patient, and then if that patient can be referred, then they can be referred straight from a triage, an online triage, rather than having to go through the GP practice itself, which obviously saves time from that perspective. But for the launch, what we did was did the triage in the GP practice itself. So if I start again from a patient access perspective and do an assessment for referral again, I begin the assessment, I go through no, I continue. We've got red flags items in here. Again, I'm not a clinician by any means, so this, like I said, this has been written by some clinicians. It's also got your traditional COVID questions, which are easily extendable and adaptable and adjustable depending on the latest government guidelines. And then you have your number of GPs, NHS centrally approved GP CPCS consultation conditions that a patient can be referred to pharmacies for. So let's just assume also for now, and click continue. Then you can see in here there are some certain questions that are asked. Depending on the answers that have been put, the patient could be referred to a different care pathway. So it could be that they have to be seen by the GP now. It's an NHS, a 999-111 emergency, or the duty doctor needs to be referred to immediately, etc., depending on the answers that have been put. But for the purposes of demonstration, what I'll put is none of the above. And in this situation, the call to actions that the receptionist or the person who's completing this form gets is that this patient is suitable for minor ailments. Based on the answers that they have suggested, they can be referred to a pharmacist for a referral. And then it's also got some useful information in there if you want to give some patient information leaflets, which can be shared with the patient themselves. We record the fact that the patient may decline it and they go, I want to see the GP, I don't care about the pharmacist, I just want to see my doctor. So we record that fact from an auditing and reporting perspective to see how many people do take up the pharmacy referral and so how many people don't. By clicking on create referral, what you've then done is taken to a patient details screen. The data for this information has been pulled through from the GP system itself. So you can see in here the NHS number, gender, date of birth, and you can see in here it's reflected in that information as well. What you can do is also put some notes in here, calls for 2 weeks, for argument's sake, and then make a note of this postcode that I'm about to, when I as well, so E10HY. So you can see in here, no double keying of information, all the data is in there. If, for example, there's a piece of information that's missing, you can easily add it in there if you wanted to, because any of the data that you put in here is what's then passed across into the pharmacy system itself, which Kevin will demonstrate in a second. I click on continue. Notice the postcode that the patient's registered in. That's where we do the search for the pharmacy. So if I was in a different postcode area, my list of pharmacies that provide this service would be in a different order, or different would be provided. But let's just go to where I know we've got an integration in the demo system with Pharmoutcomes. So you can see in here a list of pharmacies come, a directory of services listed. Pharmacies come based on geographical location, sorted order. And what you get is some metadata information about the pharmacy itself in terms of the address, the contact details, opening and closing times, and the address, and a map as well. The reason the opening and closing times is important: if a patient's contacting the practice on a Saturday and the surgery is closed, then they can go look for the next one, and then obviously book them into offer them the next one that is open rather than one that may be shut. So this is what comes up. At this point in time, you'd agree with the patient, they're happy to be referred to this pharmacy, and then you click on send referral. And now what's happening is some magic, shall we say, some technology magic. So what's happening is, from our perspective, the data itself is being passed across into Pharmoutcomes. So there's a notification that's gone into Pharmoutcomes itself to the pharmacy system, and that specific pharmacy that patient's been referred to has been notified. What's also happened in the background is an email has been sent to the patient informing them that they have been referred to the CPCS minor consultation by the GP practice. And an optional SMS is also sent to the patient as well with the referral information as well. So we can get as many channels as possible communicating to the user to inform them of what's going on. And before I sort of hand over to sort of Kevin, didn't want to do that. What I wanted to just show you is if you didn't want to go through the assessment for referral and just do a direct referral, because this patient can be referred because I don't know, they've come to us for child vaccinations. I know it's not CPCS referral in this case, but you want to just refer them off to a pharmacy, then you can, for example, refer them on. I'm just demonstrating it. That's why I put that in. I know it's not CPCS referral. That can go in. And the other option, the other thing we do track from an audit perspective is a referral report. We're amending this report to add some additional information in terms of the pharmacy that this patient's got referred into, but you got in here is a date, time, what the patient was, and the date of birth, and when they were referred for this service. So there's a small audit trail going on as well, which obviously GP practices use to track and audit the service itself. So that's kind of it from a GP land on what happens. Like I said, there are some additional stuff that we're doing in terms of improving this audit report, but we are investigating patient self-referral. So what I've just demonstrated you from a triage perspective, we're also looking to offer from a patient self-triage perspective, so they can refer themselves into a CPCS referral if they suitably qualify, and all that exciting stuff is about to come. The only other thing I sort of want to add is that at this moment in time, we do not update the patient record of a referral being made. We are working on that feature as we speak. So we expect sometime in Q2 this year to deliver a piece of functionality that means that when a referral is made, it is automatically recorded against the patient itself, patient's record, to say that they've been referred to a pharmacy referral. So that kind of is it from my perspective. And I kind of now hand over to Kevin, who sort of picks up the baton and then shows you what happens, which I think probably is more interesting for you guys from a pharmacy perspective and what happens there.
Idris, just hold on.
Yeah.
Sorry. I've got a question. This is showing communications going outwards from GP to community farms. Is there anything coming back into the system from Pharmoutcomes?
Yeah, so when Kevin demonstrates that, he will show you what happens once Pharmoutcomes complete the process on their side or a pharmacist completes that and how it gets back into the GP record.
Okay.
Can I just ask, you've shown how the practice would search using the patient's postcode for a pharmacy. What if the patient identifies the pharmacy that they want?
At this moment in time, the search... Yeah. Sorry, at this moment in time, the search box that we have is based on postcodes. I suppose we've launched this with a view to say if there are additional requirements of something that needs to be done, then we can look to implement them. Right now, we're just doing it by postcode.
So could you not just put a simple override function?
Yeah, I suppose what I'm saying is it can be done. It's that we haven't done it. It can be done.
It's very important that the pharmacy is the pharmacy of the patient's choice. And you're kind of limiting the options, aren't you?
Well, I mean, so far it's been fine because we based it based on geographical location, but obviously it can be overridden and you can search for a different postcode if you wanted to. But I accept the fact that you may want to look at it, you may want to search for it by name, such as Joy Blogg's Pharmacy, for argument's sake. I accept.
Yeah, and I think Debbie's right, because if people are starting to go back to work, say, for example, in the city from Kent, they could be phoning their doctor in Kent wanting a London pharmacy, but obviously, because they're not going to get home in time. So we've just got to think about future-proofing it. My question, Idris, was around if a surgery is EMIS enabled, because in Kent and Medway, I think they're all switching over to EMIS. Is this a free service or is this an add-on service they have to pay for? Just because I've got a meeting with them next week and I think,
it is an add-on service. I think the rate card is 5p per patient. I think, Kevin, I don't know exactly what it is.
Yeah, it's exactly Kevin that. 5 pence per patient.
Yeah, sorry, Kevin, you did do that last week with me, didn't you? Yeah. Okay, brilliant.
Yeah.
Thank you.
Should we pick pick up the Pharmoutcomes side, we can always answer some more questions after anyway. Thanks, Idris. That was really,
Yeah, thank you,
really
Idris.
good as usual. So the first thing that happens, obviously, when that referral arrives, is the pharmacy team will receive an alert via SMS. I just think it's worth, not SMS, email, sorry. I was on this page here talking about the management email.
Yeah.
Can you see it okay now?
Yes.
Okay. Yeah. Great. So you can set more than one management email in this box here, just separated by a comma, and each of those people will get an alert to that email address, which is their preference that they set. Doesn't need to be secure. I make that point because a lot of people get confused thinking they're going to get patient information. They're not. It's just going to be details of which surgery has sent the referral and the fact they've received one. We also have this device which is flashing light. So in the pharmacy I work in, I've got this on the extended cable that comes with it, and we've stuck it onto the side of the PMR monitor. So it's kind of in your face. It'll just start to flash. So we're getting quite a lot of DMS referrals since that service went live. The referral itself will appear on the services page in the same way as all other referrals into Pharmoutcomes. And these are the two here that Idris has just sent. So I know one of them, he was just demonstrating that you can send referrals for all sorts of things. And that's kind of an extension of this application, really. If you had a local travel vaccination clinic, it wouldn't fall into the category of minor ailments referral. It would be a separate referral type, but you can use this tool to refer for all sorts of reasons. The minor ailments referral was this second one down, where we had a patient presenting with a cold sore, and the top part of this table will tell you which GP practice has sent the referral, the patient details, and what the referral reason was, which is just shown in the lower box here. And then the pharmacy can either close, accept, or complete. We're just building a notification that gets sent back to the GP practice if the pharmacy closes it, to say this was closed, the patient didn't attend. But the pharmacy can also accept, which just changes the status of the referral. And when the patient arrives, they just simply click on complete now. So the follow-up is aligned with the NHS 111 follow-up. It's exactly the same follow-up. So pharmacy teams that use the system for NHS 111 referrals will be familiar with the follow-up process. And the first part of this is whether or not the consultation is being held on the telephone or face-to-face. If it's face-to-face, you've got the opportunity to record if the patient was accompanied. And if of course, the patient's accompanied in the consultation, you'll need to have the patient consent for that. I would imagine at the moment, a lot of these are going to be telephone. There's a few quick medical history questions there, just more to keep a complete record of the consultation and the history taking process. So there's investigations as to whether the patient has existing medical conditions, allergies, taking other medication, or is pregnant. If one of these boxes are ticked, an alert pops up, not to say you can't support the patient, but just to say, make sure you check the licensing on the medicine, just to make sure it's suitable for sale to a pregnant person. And if there are no conditions, obviously you're not going to get any alerts that pop up to highlight further consideration. So the presenting complaint is a list that's aligned with the service specification, which I need to say to Idris, don't send me a cold sore one, because cold sore unbelievably isn't in that list. But you can record any reason by clicking other at the bottom, and you just put in free text field that it's a cold sore, and then you got your link to CKS, where you can access the nice clinical knowledge summaries that pop up to give you access to all of that information that's there to give you further information on red flags to watch out for certain conditions and the like. So the specification requires you to acknowledge that you checked it, or say that you didn't need to. And then if you've identified red flags, the system will cover the course of action you should take. depending on what time of the day the consultation is taking place. So if you're in hours or out of hours, or whether or not you need to consider a referral to A&E or 999. You've then got the usual questions here about how long the patient has had their symptoms. If they've taken anything to date, you've got ability to record that as part of the intervention record. Same as other symptoms. If they've got other symptoms, you can record that. And then you're going to arrive at the outcome of the consultation. So 9 times out of 10, it's going to be appropriate advice and probably the supply of a medicine, either through sale or under a locally commissioned minor ailment service. If it's just advice, then the medicine fields won't appear, and you can record the advice that you've given. And if it's signposting or an escalation, further fields are revealed to allow you to document where the patient's been escalated or referred to. Escalations and the like will generate a system-generated alert that gets sent at the end of every day to the service manager, so they can see how many escalations or incidents are being reported. If you're supplying a medicine either as part of a minor ailment service that's locally commissioned, or you're providing a medicine as a sale to the patient, you would record the outcome as such, and then you've got opportunity to record the medicine that you're supplying. So this is a DM&D linked field to acyclovir, probably you're going to give for this patient, or Zovirax. It's a kind of fairly broad search of all P and GSL items. And then you're going to record your quantity and the dose. People can spell better than me. And then the last part of the consultation is the advice, just acknowledgement that you're given the advice, that again is detailed in the service specification for CPCS. If you want to supply printed leaflets, there's a link to a resource centre here, and advice on managing future minor illness. There's a non-mandatory additional instructions field if you wish to document anything else, a record of who you've given the advice to, and the requirement from the CPCS service specification to acknowledge that you've closed the consultation with advice on what to do if the symptoms get worse or don't resolve. If you want to send an incident message, you can do so by clicking yes here and detailing your incident message in this box here. And if you want to provide feedback, you can use the bottom box here to provide feedback that is monitored again from the service audit. And there's a non-mandatory notes field here that you can record details of supplies that you may have made under a locally commissioned PGD. I mean, for us locally, it may be that we see patients with uncomplicated urinary tract infection and we use a PGD to supply a 3-day course of nitrofurantoin. We detail it in here. And then you can save the record. So saving the record does a number of things. It removes the referral from the top of the screen as complete, and that referral now passes into your clinical records that have been saved here. The GP will receive a post-event message. At the moment, the post-event messages for CPCS minor illness are still on NHS Mail. I was involved in a call yesterday, and I'm pleased to say they've restarted the conversations around the workflow ID to send this as a mesh message. So urgent supplies already switched across to mesh, along with flu and COVID vaccination. The rate limiting factor for that, so that we're all clear, is not us. We're mesh accredited. We can send fire messages into mesh mailboxes. But we have to have something called a workflow ID that NHS Digital have to produce. And they were nearly there with this before COVID kicked off, and then all work halted because the focus was COVID. But those discussions have now started again this week. So I don't think we're too far away from seeing a switch for minor illness post-event messaging back to GP practice via mesh, which of course means the notification will present in the GP workflow. And depending on the system they use, there's a degree of auto filing capability within the system to file that into the patient record. So it's quite a smooth process. The other thing that will happen is the claim will be automatically sent for the pharmacy to the NHS BSA. via FHIR again. So that goes up to the BSA and will populate into MYS. And I think that's everything. Yeah, I think it is. So happy to answer any questions on that part.
Yeah, Kevin, I think that was a really good thing to see, both from the GP side and for the pharmacy side. And for me, it's a no-brainer. But I suppose the question is, you know, what is the cost and to who? You mentioned 5p a patient.
Yeah. So when we're involved in discussions, and the latest one of these was with Surrey Heartland CCG on Monday, I always make it perfectly clear because, and I know that we're amongst pharmacy colleagues here, so people will always try and play the we're moving to provider pays model, therefore the cost of this needs to be picked up by the pharmacy. It's not the case. If a GP wants this, the requirement at the moment is to provide a solution to manage a GP referral into the pharmacy that can be via NHS mail. This is all about providing the GP with a seamless mechanism to transfer referrals directly from their clinical system without leaving that clinical system. And in a moment, I think Idris mentioned it, but in a moment we will have right back to the GP record. So that automatically populates the record within the patient record in EMIS web. So this is very much an enhancement for the GPs, and to date either NHS England have been the customer or the CCG. So we make that very clear in all of these demonstrations that pharmacy is not the customer for this solution.
No, and I suppose that's the barrier, though. We're really struggling with CCGs to get them to put their hand in their pocket and pay for this. And I can't see why they wouldn't personally, but
yeah, plenty have.
Yes.
So the call that Julia was on yesterday, they've just committed to this in Surrey Heartlands. They are going ahead with this. We went live across Camden this week. The whole of the Northwest have gone live, Cheshire and Wirral, Lancashire and Cumbria and Greater Manchester, and the whole of the Northeast have as well. In those, it's interesting because I get asked this question all the time: who's the customer? And it's different in different parts of the country. So in Hertfordshire, it's been a PCN that's actually purchased this, and they're rolling out PCN by PCN. In Somerset, it's the CCG. So it tends to be groups of practices working as a PCN or a CCG or NHS England.
But obviously only EMIS practices, Kevin. So if it's system one, they can't use this, can they?
Yeah, so we will have a solution from mixed estate, and it's a really good question, Debbie, and thanks for bringing that up. Idris and the team at Pinnacle have been looking at how we can enhance the farm refer offering for a mixed estate. So the triage that you've just seen, we're looking to bolt on to farm refer. So you can create a template within TPP, as they did in Dorset, and the contact there was a lady called Emma Fleck. I speak to Steve a lot at the moment, who's her other half, so I can find out where she is and she can give you the information on how they did it. But at the end of the template, they had a button that said refer to pharmacy that had an embedded hyperlink in it, and it took them to the farm refer screen. So we're hoping by the end of June that the first part of farm refer will be the clinical triage that Sarah Jarvis created, and that will then go on to the opportunity to PDS validate the patient and send a referral to the pharmacy. So the other thing that happens is they have the option of a further add-on, so the system can send an SMS to the patient to say you've agreed to a referral to this pharmacy, so they've got an SMS to present when they arrive. And also the EMIS solution generates an email. Idris, is that right? Where's he gone?
Yeah, that's correct. Yeah.
Yeah. I've lost your name on the screen. You disappeared somewhere.
We're also getting asked a lot by practices around e-consult. That seems to be quite popular down here, and how that could be automated.
Yeah, so e-consult is something that allows, well, Idris knows more about e-consult than me actually, but my understanding is it allows a record to be made, but it doesn't have the capability to send a referral out. it kind of
I
records.
think e-consult is a triage capability for the patient, right? That's what it is, therefore, right? And what it is ultimately is the patient contacting the GP practice with some forms, depending on your conditions, which you complete, which then drops into the practice. The practice still then need to refer that patient onto a pharmacy and contact them, right? So this bit doesn't solve that bit. This bit is the bit that I know I need to refer this patient. I'm not going to refer them into that care pathway. You could use email. You could use other mechanisms that Kevin's just mentioned. But the challenge you have then is it's a non-integrated solution, right? An email could drop into an inbox. Unless somebody's monitoring that email from a pharmacy perspective, it's going to get missed, right? So from a clinical safety perspective, it's not necessarily great. I think the solution that we've done in here, it's an integrated solution. You know that patient is not going to be left in an ether somewhere with nobody being able to contact them. He'll be somewhere within that care pathway, which I think is fundamental. If you're putting patients first, surely you've got to make sure that patient journey is as good as possible, right? Because in the end, the reputation of the health of the whole area is tarnished if the patient's not treated well.
Yeah.
So
the other thing they'll get, David, is a full access to a full audit. So they get a login to Outcomes for Health or Pharmoutcomes, and they can see the outcomes of their referrals, the status of the referrals, what happened when the patient was managed at the pharmacy. So they've got complete visibility from end to end.
Yeah,
And
and we get a
some
dashboard as well,
confidence.
don't we? Sorry.
Because I think the other thing to bear in mind is if it happens through any other mechanism, an email or even something that practice sends an email off, it means that the pharmacy land, the pharmacists will have to double key that data in. They'll have to take the data from the email, take that into the Pharmoutcomes, and that in itself brings up clinical risk. You could copy and paste something incorrectly. You never know what will happen when people are under pressure. So yes, of course, there are solutions that are out there, but I think for a small fee, I think the solution that we're providing, I think personally, it's a no-brainer. I mean, I'm a technologist. I'm not a clinician person. All I try to do is provide technology solutions where you can connect up systems. And to me, it seemed like, and I did this not because of money. I did this because it just kind of made sense to me, because I didn't want to have the operational overhead, and that's why we did this. And then it just seems to have hit the right sweet spot. I'm not saying it's the final product, by the way, David and Deborah and the team. I know there's improvements that we can do on the product itself, but we kind of didn't want to wait to build a perfect solution, which was 3 years later. We wanted to get something out in the market and get feedback, and then get your feedback to improve the product. And that's what we're doing. That's the journey that we're on. And to answer the e-consult question as an example, one of the big feedbacks that we've had from real life, real world evidence is that we want patients to self-triage themselves. So if you take the e-consult as a solution, the e-consult means that the form still needs to get to the practice to make the decision whether this patient can be referred. However, if you had enough intelligence in the form and you trusted the form to take care of it, knowing that the patient is going to be treated by somebody who's clinical expert, whether it be the pharmacy, or whether it be GP, or whatever the case may be, then surely getting the patient to self-refer themselves into a pharmacy, GP, CPCS consultation. It's not even going into the GP practice. You can certainly see how it opens up the whole health economy and making it work well. And it's still trusted, it's still validated. We still make sure that the data gets back into the GP system. So just in case, if you want to do an audit, the practice can just make sure there's no gamification or anything that's going on. So it's still done properly. But that would, to answer sort of the long way around, to answer your question, David, I would see this as a complementary service for a specific need, which is a minor ailments referral service that you want to plug into, rather than trying to replace e-consult. I mean, that's how I'd see it.
I mean, currently there is no self-referral into CPCS, is there? And we worry about GP practices telling patients just to go to the pharmacy. So you can see that would be useful as and when we are allowed to accept self-referrals, but that wouldn't generate any payment.
So we already do it with NHS 111 because we accept ITK referrals in from NHS 111 online. So that's the patient filling in a triage form.
So you're saying, Kevin, that if a patient fills in the self-triage on the GP system, that would count as a GP referral to us?
That's what we're aiming to do, yeah. So, and the way that we've had several conversations with a lot of the stakeholders, and we had an interesting conversation yesterday that we're taking away to look at, and it was that individual GP practices would may have the ability to set tolerance levels. So they might say, you know, we want to err on the side of caution, or we're happy to go along with whatever the recommendation is of the triage, and the patient would be given an option and fill in an online triage form, and that would generate a GP CPCS referral. In the same way as NHS 111 online sends a CPCS NHS 111 referral.